Hi guys. Hi. Hi everyone. We'll just wait for a little while for a few more people to join in and then we'll start. Yeah. Can you guys hear me? If you can hear, you could just put a thumbs up. Yeah. Any echo? Anything like that? So just before we start, yeah. Yeah. Hi, Haribala Krishnamal. Haribala. Okay. Hi, Haribala. Yeah, we'll just wait for another 30 seconds and then we'll start the discussion. So this is primarily for final years. So all those in final year who want to start preparing, this is mainly for them. So after also the last bit we'll talk about how an intern can prepare, because obviously the final years also will be doing internship next year. So how to utilize that period well too. Yeah, so we'll start. So firstly, an introduction. I'm Dr. Vignesh. I wrote my NEET PG this year. I was an intern last year, and although there is a belief that interns can't clear going around in the market, I was also victim to that. I believed interns can't clear, so I never really took my NEET PG seriously. And somehow in the end, I decided, okay, last 3-4 months I'll study something. Last 2 months I really sat down to it and started studying, and then I wanted to give a genuine attempt to the exam. So I studied for 2 months very hard and went and wrote the exam. And fortunately for me, I ended up with a rank of 6,700. It's not the best rank, but it was a good rank for that 2-3 months of preparation that I did. So what I realized at that moment was, what I did in those 2-3 months had such a good impact, and if I had done it for the whole of internship or even started it a little earlier, I might have done far better and could have even been within the top 1000 ranks. So here I am today, not because I did any of these things that I'm going to talk about, but rather these things that helped me in those 2 months, I've extrapolated for a 1 year plan, so you can utilize it and see if you benefit from it. So that was the introduction. Now we'll talk about the strategic approach, or the best approach that final years can use to get a good rank, and also after final year how you should approach internship and the best way you can utilize internship to maximize learning. Because remember, like I said, I am more focused, or I started primarily in my internship, so my discussion will be more the part where I talk about how intern should prepare will be more beneficial. So firstly, as a final year or as an undergraduate, that is any time before final year, only two things should be your aim. Okay, if you're preparing for NEET PG, you should have only two aims. The first and the most important aim is to master the concepts. So all the core concepts and all the basic concepts you should master. And the second thing is to create material that you can study during internship. So remember, internship is busy, it's hectic, and you won't really get too much time to study. So your aim right now should be to create material like notes or little flashcards which you can use to revise what you have studied in internship. So master your concepts and make material, make notes that you can read during your internship, and as you progress through internship you'll need material. So those are the two aims that a final year or an undergraduate should have when they are approaching these exams. So what are the core principles for a final year to follow? So I feel there are 4 core principles that any final year should follow. Firstly, and most importantly, remember, you still have a university exam, and even more than cracking NEET, your aim should be to crack or do well in your university exams. So study for that on a regular basis, study for clinics and for theory. And also remember that NEET also is based on these same subjects. So the same subjects like medicine, surgery, OBG have a good weightage even in NEET. So studying well for university exams definitely helps in NEET. It's not like there's a completely different study pattern. The concepts are the same, the core is the same. So master the core. So the next point again is just a variant of this. build concepts and work on strengthening them. Remember, concepts are what stick on. You can read facts, you can read notes, but all that you'll forget. It's the concepts that last for long. So if you master the concepts in final year, you can read the facts and memory based things in internship, and you won't have to revise the concepts or relearn the concepts again. So use final year to build the core and build the concepts and understand every disease process in detail. And when you're studying subjects like medicine, have a look back at physio, have a look back at pharmac, have a look back at patho related to that topic. For example, if you're reading about inflammatory bowel disease, ulcerative colitis and Crohn's, you read about those chapters from your medicine book, and then if you have a little time, go back to your second year books and look at the pathology of IBD, or in pharmacology, what are the drugs used in IBD, and that helps you both in medicine and in revising, and overall your concept becomes very strong because you're linking subjects. Okay, and you know that the NEET pattern is changing, and next also we'll have a new pattern, and this new pattern will be more conceptual. So building concepts is very important. So study for university exam and work on building concepts. The third thing, in fact the most important thing on the screen, is to focus on clinical subjects. So take your clinics very seriously. Remember, we are all here to become doctors, so attaining clinical skills should be your primary focus in final year and internship, along with NEET preparation. And definitely clinical skills will help you do better in NEET too. So don't worry about the NEET exam per se, but knowing clinics well and seeing things in clinics will help you remember things better, and that will eventually start helping you in the NEET exam. Okay, lastly, and this is for those who are completely NEET oriented, remember, practice solving MCQs. So NEET is an MCQ exam, right? NEET or next, whatever you're writing, it is an MCQ based exam, and the only way you can do well in MCQ based exam is to solve MCQs. So most of you, for your university exam, you would be using some or the other question bank, right, to find out which are the most asked topics, which are the most asked questions, and you will study only those topics most of the time. For example, if you take coronavirus, it was never a big question in the past. So most of us, when we are doing micro, we never really even read about coronavirus because we are sticking to what is usually asked in the exams. Similarly, even for the NEET exam, remember, there is a Q bank. There are books, there are sources, apps where there are Q banks. Even Unacademy is starting a Q bank soon. So there are Q banks, and use these Q banks well and solve questions from Q banks. The only way to crack an MCQ exam is to practice MCQs and to master the art of solving MCQs. So you should be able to solve. And the another advantage of doing MCQs is, it is the MCQ is nothing but the application of what you have learned. So if you learned about, again I'll take the example, inflammatory bowel disease, you go back to patho, you see the patho, you go back to you go back to pharmac, see the pharmac, and you study the medicine, and then you solve a few MCQs from inflammatory bowel disease to see if you're able to answer. And if you're able to answer, that means your concept is strong, your core is strong, and you have understood. If you're not able to answer, it means you have to read again, and most of the MCQ books and guidebooks have explanations given below which can help you. So definitely, after you read a chapter, whatever the chapter is, take 15-20 minutes to solve a few multiple choice questions from that chapter. Okay, so that this will definitely help you, because it gives you a practice in solving MCQs, makes you know if you have understood the concept well, therefore helps you in the university exams also. And in the long run, solving MCQs is the best and most effective strategy for preparing for any entrance exam. So remember, so if any thing I want you to remember from today's discussion, or just one thing you should take home from today, it is that solving MCQs is very important, and solving MCQs can make a big difference to your preparation and your score eventually. Okay, so these are the 4 pillars or the 4 basic or core principles I feel a final year should focus on when they are preparing for NEET PG, or when they have NEET PG in mind. And again, a lot of people I've seen, they forget about the university exams and they just keep solving MCQs. So don't do that. Build concepts, build your core, and then solve MCQs. Another point I told you, you have to create content, right? You want to create material that you can revise from. Okay, Shreya, I'll answer questions in the end. Okay, we'll have 5-10 minutes for that, so don't worry, we will get into that. So remember, now coming back to creating material. So you should create this kind of material like I've shown on the screen right now. there are many high yield topics, there are many important topics, and you will know which are important by again solving MCQs. So when you solve MCQs, you will find a repeating trend or repeating questions from a certain topic. Here for example, I've taken keloid, which is a popular topic for the exams. So again, you will find a repeating trend, and you will realize as you keep solving what are the important topics. So make a list of all these important topics and try to create such one page notes or a single page with everything about that disease written in it. So I used to call these master notes, and in this one page I would mention everything related to an exam or everything required for an exam like NEET. I would write it all in one page. For example, now we look at keloid. I've just written keloid is a defective scar formation in which there is a hypertrophic scar, the boundary of which extends beyond the site. It is due to increased growth factors, there is hypervascularity, and I have written that there is increased type 3 collagen. So why have I written this in a different color? Because that is frequently asked. That is a question that is usually asked. So remember, whatever is usually asked, you can write it in a different color, or you can highlight it, or you can underline it. But basically you want to create one page notes or one page for all the for every chapter you should have, or for every major topic you should have one page notes, and this will help you revise and go through those topics quickly. So that's why again, even for larger topics like placenta previa is a very important final year topic and a very large topic. It extends into pages. If you read a textbook, this chapter goes on for like 15-16 pages. So I have compressed the whole thing into one page, so by solving MCQs and knowing what is asked and what is important from these chapters. So you can look at this sheet. It was one sheet, I've cut it into two so that it's legible, but you can see how I have split it and written the definition, then the clinical features, then what are the examination findings, then provisional, then the investigations to be done, and then the management. So every time you study in this structured or under headings, so that will help you retain and remember better. Okay, so before we move to the next session, we have next part of this discussion, we have two questions. Firstly, from Shreyas asking, good evening sir, will it be worthwhile attending the session for second year medicos? Definitely it is helpful for second years, for any year, because ideally I'm telling you how to prepare on a long term. I'm not telling you how to cram. There are other videos where I've told interns how they can cram and finish studying in 2-3 months, but in this session we are going to focus on how to prepare on a long term. So definitely Shreyas, this will help you. Okay, and next Surabhi asked, sir, where did you solve MCQs from? So there are a few books. I would recommend Sakshi Arora for OBG is a good book, and there are a lot of guide books like Rome's and Arvind Arora which you can take and read. There are also apps like PrepLadder and Marrow. I've used them. So all of these sources are available, and like I said, Unacademy is coming up with a question bank in a month or so. So that will be a really good comprehensive question bank, and you can look into that. So Surbhi, that's where I did it from. And remember, solving MCQs is very important. Okay, and I think we have covered Shreyas's question also. Yeah, so it is beneficial for second years, because even like I said, when you're in second year, open a patho book, read a chapter from patho, for example, again inflammatory bowel disease, and then go back and solve questions from that chapter. That is the best way you can do it. And solving questions, make sure, one, that you master the concept. It checks how well you know the concept, and two, you will know where your mistakes are or which part of the concept you didn't understand completely. And three, of course, NEET is an MCQ exam, so practicing MCQs always helps. So that's how second year should plan, and as they go every year, they should remember to take out 1 or 2 hours a week just to solve MCQs. Okay, and it will definitely help you if you do that. So that was about the single page notes. The next thing is, there are some important facts. So NEET is not just a conceptual exam. There are in fact more fact based questions and less conceptual questions. If you take a 300 question, around 200 will be fact based and only 100 will be conceptual. So there are some important facts, especially something we call the most commons. So they usually ask which is the most common disease, or which is the most common bleed, or which is the most common cancer. So these are fairly frequent questions, and they keep asking most commons, and it's very fact based. It's only something that you by heart. So what I used to do is, I had a small notebook that I had kept, and in that book I had written all the fact based things which are repeatedly asked. For example, here I've taken most common cancers. They frequently ask which is the most common cancer of men worldwide, or which is the most common cancer in men in India. So for that I made a list to make it clear and I used to write down all these high yield facts into a single page and use that as a reference for my preparation. And when I used to prepare, especially the last 2 weeks before NEET, I went through all my fact-based points that I'd written in a book. And again, sometimes there are some controversies. We always get confused and think CA cervix is the most common cancer in women in India and not CA breast. So for things like that, I've also written a little bit of statistics so that it sticks in my mind that breast is actually more common than CA cervix. So remember to make all your fact-based things into one book, and that will become a gold mine for your preparation or for your last minute revision. Okay, so that was about tackling the fact-based questions. Next, so you finished final year like this. So basically what you did so far in final year was you read chapters every day for your theory exams, and after reading those chapters for your theory exams, you went back and solved 10 to 15 MCQs from that topic. So if you read IBD, 10 questions or 15 questions on inflammatory bowel disease. If you read dermatology, which is part of medicine, again you will solve around 50-60 questions from dermatology to strengthen yourself and to master your concepts. Psychiatry, same thing. So whenever you study a subject or a topic, you have gone back and solved MCQs, and each time you solved MCQs, you wrote down in a list and made a list of what is frequently asked, and for each of those frequently asked topics you have made a single page or 2-page note in which you have tried to incorporate or involve everything important from the topic. You have tried to fit it into these small notes. So now you're entering internship, you have these notes of high yield topics, and you also have a notes of high yield facts. I told you fact-based questions also you try to write in a book. So you have these 2 books with you when you're starting internship. Remember, you should always have these books with you. Every time you go to the hospital as an intern, you should have these books with you because you are going to keep revising. I told you your first year, second year, third year, final year is mainly focused on making short notes that you can revise during internship, because a lot of this content is volatile. You can very easily forget whatever you're learning. So concepts will stick, but facts will keep going away. So that's why you should make content and you should have a book with everything written on it and keep it ready. And whenever you're an intern, whenever you get 5-10 minutes of break, you're going to go through these books and go through these facts that you have made from first year to now. So you'll have a beautiful collection. And if you're starting in final year, all the facts you made in final year have, and remember, notes should be very concise. I've seen people writing 4 or 5 pages of notes. No, it should be very concise. Just the 3 most important, one definition, 3 most important clinical features, 3 most important clinical findings, 4 or 5 most important investigations, at least most importantly the investigation of choice and the gold standard investigation, and then management, just the headings. So that's all is needed. They won't go into further detail. Okay, so make your own notes and that will definitely help you. Final year, spend time making notes and making short notes. Please don't make long notes because it's not going to help you at all. So you've done all this, you have this material, and now you have started internship. So how are you going to use this internship in a effective manner? So firstly, let me tell you that internship is, at least in the private colleges and in most colleges, is a period where you get a lot of free time, and you don't get free time like 5-6 hours together like how you get in final year and second year and all, but in between the day, in between work, in between 2 OTs, in between getting a blood report, or when you're waiting for a discharge summary, you'll get 15-20 minutes of gaps, and many gaps like this of 15-20 minutes, which if you add will end up becoming 2-3 hours a day. So all these 15-20 minute gaps that you get during internship, even 10 minutes gap, either take out a book or an app and solve MCQs, or take out your master revision notes that you made in final year and go through the important points from that. So that was how you can spend or utilize time in the day. Now a few other points. Firstly, do internship sincerely. There's a lot of confusion. Oh, if I do internship sincerely, I can't study for NEET and all that. So don't worry about that. I told you NEET is moving, or NEET and next are moving towards a clinically oriented question style. Therefore, those who do internship well can end up answering a lot of questions and do far better. So do internship sincerely. It will help you in life, most importantly, and also in NEET. Secondly, use all the interim time to solve MCQs or read those master notes that I told you about. So interim time, I told you, you're waiting for a discharge summary, or you're waiting for your PG to give you orders, or whatever it is. At that time, use it to solve a few MCQs. Another thing that I used to do was, every day morning when you wake up, spend around half an hour solving MCQs or revising your notes, and before sleeping again spend around half an hour solving videos or revising your note. Don't spend too much time on lecture videos. So This is as an intern. So when you're final year, you want to master concepts, so definitely you can watch lecture videos and make your notes. But when you're an intern, you have very little time, and that little time should be spent in revising the notes you have already made, or learning new concepts by solving MCQs, or reading small books and not watching the 1 or 2 hour lecture videos, because that is a waste of time. So you are very short on time in internship, so you have to be very precise, and you have to be very miserly with your time, and use time only in a very effective manner. So solving MCQs are always the most fruitful way of approaching these exams. So remember, it's an MCQ exam, so whenever possible you should try and solve MCQs in internship. But I told you, at your state you have to create the content. So this is when you become an intern, what you should do. Lastly, a few myths that are going around the market, and few things that people believe. The first and the biggest myth I want to bust today is that it is impossible to clear NEET during internship. So firstly, I told you, I was also victim to this. I also used to wonder like, hey, we can't clear NEET during internship, I'll just repeat. Oh, it's not possible, everyone else is repeating. So don't have that thinking in your mind, because if you have that thinking, you will definitely repeat. Those who think that they will repeat will end up repeating, and those who think that they can clear will end up clearing. It is not impossible, and if you look at the numbers, if you look at the data, most of the people clearing these days are fresh interns. So never have the thinking that it's not possible during internship. So it is possible. Second thing, it is never too late to start, whether in first year, second year, final year, or internship. It's never too late to start preparing for NEET. There's no fixed timings. This is an exam where there's a lot of repetition, and all the questions come from a select number of high yield topics. So identify those high yield topics and study them well, and you will definitely do well, and solve previous year questions. Okay, so it's never too late, and it is definitely possible to clear the exam during internship. Okay, third myth is doing internship seriously doesn't help in NEET. I told you, doing internship seriously will help you in NEET, especially in this year's NEET, the one I wrote. A lot of things that I saw in internship ended up coming in the question. And the worst thinking is, this is just an attempt, this is just the first attempt, I'll do better next time. So please don't go into the exam with that thinking. Think of it as your last and sincere attempt, and go in and give it your best, and then you'll do well, because repeating 1 year is not worth it. Sitting at home and reading is not worth it. See, if you give your 100%, then you miss the exam, and then you repeat, it's accepted because you're given your 100%. But if you're just going to take a lax attitude, a careless attitude, and then you don't give your best, and then you end up repeating, that is not at all going to be helpful. So lastly, believe in yourself and put a genuine effort. It's never too late, and it's not impossible. Believe in yourself and put a very genuine effort, and be sincere to your studies. And lastly, clearing NEET during internship should always be your plan A and never your plan B. Everybody, if you look at them, they're like, I'll write it during internship, and then next year I'll write it seriously. And so clearing is their plan B, and repeating is their plan A. So never let that happen. Repeating should be a plan B, and clearing it in your first attempt should be a plan A, and you will be extremely happy if you save 1 year of your life by clearing it early. Okay, so let's take a few questions. So should we read standard textbooks, or rather focus on notes for preparation from online platforms? So definitely I would say don't read standard textbooks. I don't know where, Shreyas, you're in second year. So when you're in second year, you can read standard textbooks like Patho for Robbins, and Anant Narayan for microbiology. So second year you can read standard textbooks and master your concepts well. But when you're studying in internship, you won't have time to read standard textbooks, and that's why I recommend right now you make a notes, or your own notes, which you will be able to revise. So a revisable short form notes you should make. You can use the standard textbooks as a source to make those notes. Okay, so definitely in internship you won't have time to read standard textbooks. So right now, yes, read standard textbooks and make your notes, and read notes from those standard textbooks. And again, like I said, if you read and make your notes, it will be more beneficial than if you watch or get some ready-made notes. Okay, so any more questions, guys? Anyone else has questions? Okay, so I don't think we have any questions right now, so you guys can think and see if you get any questions. So I'll tell you Yeah, I'll tell you a little story about how internship can help you in the NEET exam and how it helped me rather. So I told you I was an intern last year, and just in September, October, just before NEET, few months before NEET, I was posted in pediatrics, and I was in the I was posted in the PICU. I was on duty one night, and here in Karnataka we have lots of cases of dengue, and many a times it gets serious. The platelet falls less than 5,000, and we decide to give platelets. The standard is 10,000, but sometimes we even give when it's lower than 5,000. So this child had low platelets, so we gave the child platelets. The child got better, and the SDP, that is a single donor platelet, the bag was empty. So I was asked to dispose the bag. So I took the bag and I was going to dispose it. And if you, those who know practically, we always dispose these things like Euro bags and these rubbery materials in the red, because they can be recycled. So I was about to, and not about to, I actually disposed this platelet bag or blood bag into the red bag. And immediately the sister came to me and said, no, this is wrong. The new guidelines say that blood bags should be disposed in yellow and not red. So yellow is for infected waste, so they should be disposed in yellow and not red. So I was like, no, this is not how it works. I know better. I'm putting it in red. We dispose all these kind of things in red, including Euro bag, so I'm disposing this in red. So then she said no, and she changed it to yellow. So I went online to prove her wrong, and I searched where do you dispose blood bags, and then I saw that blood bags are actually disposed in yellow. So I was proven wrong. It was humiliating, but then they are more experienced, and I learned on that day. I learned that blood bags are disposed in yellow and not red waste. And when I went for NEET, when I was sitting during my NEET exam, this is a question that actually came up. It said, where would you dispose blood bags? Dash A red, B yellow, C white, and D blue. So these were the options, and the answer was obviously yellow, and I put yellow and got it right. And the only reason I knew this was because I did my internship well, and I learned while doing my internship. And that's why I'm telling you, being practical and doing your internship sincerely can definitely help you in NEET exam. And this is just a small example, and like this there are many examples that I experienced during my internship. So this is just a small example. So because that sister that day told me that this is disposed in yellow, I got 4 extra marks in NEET, and 4 marks makes a huge difference in the ranks. Okay, because I might have put red, and majority of people put red as the answer, and they all got even -1. So effectively I ended up getting 5 more marks, and maybe 100-200 ranks more, because of that one question and that one incident that happened during my internship. So remember, doing internship well and being completely involved in your internship, even things like throwing away the waste, can make a significant difference to your score. So a little story to encourage you guys to do well in internship and do your internship actively. Okay, so the next question, sir, how to identify high yield topics? This is one area I'm always confused about. Every topic seems to be high yield. So Surabhi, like I told you, when we want to know what comes in university exams, we refer to question bank. Similarly, when we want to know what's important for these entrance exams, we refer to again a question bank, either of some app or of some books, and these questions, especially the previous year questions, will give you a good idea. So spend more time looking at previous year papers and previous year questions, and the topics that are more questioned. For example, thyroid, you have a lot of questions from thyroid. And if you look at suppose lithium in pharmacology, again you have a lot of questions coming from lithium. So these seem to be important, because among vitamins you have more questions coming from vitamin B12 than from B5. So therefore B12 is a high yield topic, whereas B5 is not as high yield. So you just need to know about it very briefly, or have very